Today, we'll be talking about how to treat dark circles under your eyes. It's a very common presentation. So what are the causes for dark circles? First and foremost, the skin under your eyes is very thin. This makes the vessels that are present under the eye visible on the surface. So vessels in these areas are blue in colour. That's why you tend to sometimes get a bluish tinge or a bluish hue under your eyes. This will further worsen if you are a person with bonier and very little and thin skin. It gets very hard to treat as you're dealing with bones. The process of aging can lead to dark circles because there is thinning of skin in this area. There is also protrusion of fat. This can lead to eye bags and making this area look more dull and tired with age. You can also develop tear troughs. This can also make your dark circles appear even worse. Common causes for dark circles is rubbing your eyes. Lots of people have this bad habit of rubbing their eyes. It can lead to thickening of skin under this area. Nasal congestion, running nose, allergies and contact dermatitis can lead to dark circles. You could be allergic to eye drops that you're using, or cosmetics, or even nail polish. Even eczema can lead to dark circles. If you have atopic dermatitis, in which there is dryness and itching on the skin, this can also be associated with darkening under the eyes. A lot of under-eye creams contain plant extracts. It could actually be worse than your dark circles. Prolonged exposure to sun can also lead to darkening of the skin under the eyes. There are certain lifestyle changes that can also lead to dark circles, such as a lack of sleep, increased intake of caffeine, and sitting in front of computer screen for a long period of time. Even consumption of alcohol and smoking can make your dark circles worse. Vitamin B12 deficiency can cause darkening of lips. Certain hormonal changes can also lead to dark circles. If you have dark circles, along with darkening of the forehead, sides of the face, around the mouth, neck, underarms and groin, then you could be having acanthosis nigricans. It is commonly associated with diabetes mellitus, but it can be a manifestation of stomach cancer. Dark circles could also be genetic or hereditary. So if you have family members who have dark circles, then there's a high chance you could also suffer from dark circles. This is by far the most common cause. Is constitutional, which means by race. So for example, Indians, some Asians will have dark circles around the eyes, and that's hereditary. And the way to distinguish that is actually look at the dark circle and see where they extend to the upper lid. In this group, you can't do much to make the dark circles go away. It's very important to figure out what causes dark circles before treating and moving to treatment. First and foremost, I want to start by saying that it is very difficult to treat dark circles. You might never get rid of it completely, but we can make it better. My DIY tips in this regard to dark circles around the eyes. Firstly, make use of sunscreen, because more sun exposure around that area can increase the pigmentation. You've got to use a very good sunscreen. Sunscreen of choice is something like zinc oxide or titanium dioxide sunscreen. Remember to wear sunglasses as well. What else can we do? Double up in the pillow, so if you sleep, decrease the pooling of blood. If you have dark circles, you should absolutely not rub your eyes, so please break the habit of rubbing your eyes. It is only going to make dark circles even worse. If you have allergies, rubbing and itching can be minimized by antihistamine, so it will help to regress dark circles. Another thing that you can do is apply frozen tea bags. You can place tea bags in the refrigerator, and then you can put these tea bags onto your eyes for about 5 to 10 minutes. It will rejuvenate your look and also reduce the puffiness and swelling under the eyes. You should cut down on your caffeine intake if you have dark circles. Let's go through other modalities of treatments. Unfortunately, there's no cream that can do much for dark circles. First, we need to understand what the cause for dark circles is. One thing you can try is hyaluronic acid-based creams to help smooth the delicate skin around the eyes. These eye creams boost skin's hydration level. Just apply a little bit under the eyes, and this really does a nice job. Get a cream which is fragrance-free. Next option is retinol. Retinol helps cell turnover. It helps with dark circles, premature aging, and those fine lines and wrinkles. Make sure that you're using a lower percentage retinol. Use the lower dose that is 0.5 around your eyes. You can graduate up to 1.0. Retinol can make you sun sensitive, so the best thing to do is to make sure you're using it at night time. Put it on clean skin, wait 5 or 10 minutes, and then use a nice moisturizing cream on top of it, just to make sure that your skin is not getting too dry. If you get dry eyes, you might have to stop. You might want to take a second look at your retinol creams and whether or not you should be putting it. If you have prominent blood vessels under your eyes and your dark circles turn to bluish, then you should look for vitamin K in your under-eye cream. Vitamin K is regenerative and helps in wound healing. It is also an antioxidant that helps with issues around hyperpigmentation by scavenging free radicals that can lead to upregulation of melanin production. Ascorbic acid, or vitamin C, is an antioxidant. It scavenges free radicals, especially from sunlighting. You can have fresh fruits that are a good source of vitamin C. Let's see how to approach dark circles due to anatomical or bony prominence. This is not reversible with creams. We can use dermal fillers. This filler lasts for about 12 to 16 months, so you may need to repeat this procedure. Dark circles, due to genetics or ethnic related, may respond to switch laser, but we can't predict the results. Chemical peels also have been used by dermatologists. Common ones are used low concentration of glycolic acids, lactic acid and kojic acid, arginine mandelic acid. These are usually used for treating the under-eye areas. You need to take multiple sessions of these peels. These need to be repeated every 10 days to 2 weeks, and you may need to take 8 to 10 sessions to notice improvement. It must be done with caution. You should not try these by yourself. Please do not use any kind of harmful harsh material on your under eye because the skin in this area is very soft. Please refrain from using ingredients such as lemon, baking soda or toothpaste, or any kind of irritant substances under your eye. We hope that you gained good knowledge regarding dark eyes and its treatment options. We hope that it will help you to get rid of dark circles you've been suffering from. Thanks so much for watching. Make sure you subscribe to our channel. See you next time. Bye!